I'd like to call this meeting to order. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call.
Councilwoman Karumba. Here. Councilman Purdon. Here. Councilwoman Carr. Here. Mayor Simmons. Councilman Corey.
Here.
Councilman Gibson.
Present.
Councilman Forbes.
Here.
I'd like to make a motion to allow the mayor to join us electronically.
Second.
Roll call.
Councilwoman Karumba. Aye. Councilman Purdon. Aye. Councilwoman Carr.
Aye.
Mayor Simmons. Councilman Corey.
Aye.
Deputy Mayor Gibson.
Aye.
Councilman Forbes.
Aye.
So everybody's microphone's working all right?
I think so.
Jesse?
Yes.
Yes, sir. Okay. And we have the mayor on the line? I don't hear him.
Mr. Mayor, can we get proof of life?
I'd like to call this meeting to order. Please rise for the Pledge of Allegiance. It says, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Test?
We're on a loop, I guess.
Is that the man?
Councilwoman Karumba. Here. Councilman Purdon. Here. Councilwoman Carr. Here. Mayor Simmons.
I was thinking the same thing. Let the meeting continue on its own. Yes.
So we're waiting for the mayor?
Let's give it.
I'm just waiting to see if they have the mayor on there.
I hear ourselves.
I think we are contacting the mayor, but he is on the line, so we're just making sure he can hear us.
Okay, should we just go?
You could keep moving forward.
Okay, tonight's a special meeting regarding face coverings. We do have a couple people here. We have Phil Dutcher from NCH and also Michael Nachif with Lee Health. If you guys wanted to come up and talk at first, or?
Good afternoon. I'm Phil Dutcher. I'm the Chief Operating Officer for the NCH Healthcare System and a proud resident of Bonita Springs. I'd like to give you just a quick summary of the COVID pandemic that NCH has experienced since its beginning, give you an idea of kind of how we've prepared and adjusted to it. NCH has tested a total of 16,800 tests since the onset of the pandemic. We currently have 133 patients that have tested positive for COVID-19 in the hospitals today. We have a census today of about 480 patients, so 133 out of 488. NCH has discharged over 500 COVID patients home for their recovery. Our open adult bed capacity at NCH currently stands at about 24%. So we have a licensed capacity of 715 beds between the two hospitals. We have about a 24% available open bed today. we do have the ability to expand that 700 up to over 1,000 if need be. Our open critical care bed capacity stands at 41%. Even though we've seen an uptick in the volume of COVID positive patients from about 50, 55 during the March and April time period up to 133 today, that upsurge has really been a lesser acute patient. Average age of about 39. They're staying about 2 to 3 days versus the 5 to 12 days before. We have 5 employees who are quarantined at this point in time, and 42 employees that tested positive, but as a result of community-related exposure, not hospital-related exposure.
How do you know that?
The number of individuals who have passed away at the NCH facilities due to the COVID-19 stands at 31 today. So those are some statistics that I wanted to share with the council tonight. NCH believes it has adequate capacity today to handle what we perceive to be the surge. We have not chosen to stop any elective surgeries, but we're looking at it on a day-by-day basis to assure ourselves that we'll have enough adult med-surg beds for if, in fact, this trend of upward positivity continues.
Thank you.
We've got actually.
Do we have any questions for him?
Would you guys like us to ask you NCH and then Lee Health separate questions? I mean, there may be overlap, but do you want us to let Michael go and then we'll ask all of our medical questions, or do you want us to? Okay.
Okay.
Hello, Council. Thank you for having us here tonight. My name is Michael Nasha, for the record, System Director of Government Relations for Lee Health. I have been working with your staff to send you daily statistics of the pertinent information, many of which may be addressed in your questions, but just to give you an overview of where we are today, July 14th. We have 358 confirmed COVID-19 patients in our hospitals. That's 307 inpatient, 50 in our skilled nursing unit, and 1 in our rehab. Cumulatively, we have experienced 156 deaths from COVID-19 from the start of the pandemic. Our census today is 1,239. That's out of 1,300 available beds, so that's a 95% operational bed capacity. We have over 1,500 licensed beds at Lee Health, but the challenge at this point in time is finding the staff to make those beds operational. So we're working with the governor's office and FEMA and others to continue to bring in staff as much as possible. We had also had a number of staff that took summer sabbaticals that we're hoping to bring back and keep them working in the health system. Right now we're using 35% of all ventilators. That's 67 of 191, and 27 of them are being used by COVID-19 patients. 91% of our adult intensive care unit rooms are in use. 46 are being used by COVID-19 patients. That's out of 123 rooms. We're able to flex up intensive care unit rooms. An intensive care unit room is not a physical location. It is staff and it is machinery to make it intensive care. There may be some limitations related to the amount of staff we can flex and the amount of machinery. I know that was a question that some people in the community and members of council may have. We currently have 579 quarantined employees. That's related to all exposure, community or otherwise. We have pretty strict protocols in place, whether or not they've tested positive, if they're exhibiting symptoms and waiting on a test, or otherwise. So today, for testing, as a total from the start of the pandemic, we have tested 29,557 individuals. I apologize, I think the feedback from my phone, sorry about that. 29,557 individuals total have been tested. 5,351 of those have been positive. 24,206 have been negative. That's an 18.1% conversion rate from the start of the pandemic until now. In recent weeks, it's certainly been trending a lot higher than it had been at the onset. Back in April, May, we were trending more around 8%, whereas today, on a daily basis, we're trending closer between 28 and 35% conversion rate of positivities. Not everyone that converts positive needs to be hospitalized, of course. Of the 358 confirmed in the hospital today, we have admitted 45 on this day, and we discharged 44 who are recovered and were discharged. So that's the 358 is a static number, what we have in the hospital today, but they weren't all admitted today, of course. And that gives you an idea of where we are from the start of the pandemic in terms of testing, capacity, and census. I'd love to be able to answer your questions as you have them, and I know Phil will as well. Mr. Mayor.
Thank you for your report, Mike. What is the single thing that we can do as a community to lower the number of COVID-19 cases in Bonita Springs?
Councilman, I think the CDC recommendations for physical distancing, masking, and good hand hygiene are strong things that we can do.
Let me ask a question because I understand that the death statistics that are being reported by the Florida Department of Health are running around 25 days from the actual date of death. So what's reported today is more than likely what happened in terms of death on June 20th, because it takes a while for it to filter through the system from the death certificate through the county into the vital statistics of the state and on to the Department of Health. I did read today that the 7-day moving death rate in Florida from July 1 moved from 38 to 81 today. Are you seeing any signs of an increase in the death rate in Lee County from what you're seeing in the hospitals?
Speaking for Lee Health specifically, yes, sir. So as you indicated, death rates are generally a lagging trend from positivity rates, which are closer to that day of statistic. For the numbers I cited for you, for Lee Health, that is up to today. So in the last several days, we have noted a catching up death rate that is higher. Yes, sir.
Thank you. Finally, even though many of the COVID patients are the ones that tested positive, it's not necessary to hospitalize them. They still need to be quarantined, as I understand it, because they do become, at that point, carriers, and they can infect other people. Is that correct?
Yes, sir.
Thank you.
Yeah, I've got a couple questions. Number one, why, it seems to me that flu is starting early this year. Is that your observation?
Councilman, I apologize. Can you repeat that question?
It seems that flu, or influenza, is starting earlier in the year than normal this year. Is that right?
I see. So normally speaking, influenza would start in the fall. Yes, sir, as I believe you're indicating. In terms of Lee Health statistics for influenza, we have, to this point, I've not seen an uptick. But
I'm sorry, could you repeat that?
at Lee Health's facilities, I have not seen an early trend statistic indicating that influenza is on an uptick at this moment. But I have read some national trend data that could reinforce the councilman's point there.
Okay. Now, is it true that on blood types there's a difference? I've heard that type O is you got a better chance if you're around Corona and you have type O than if maybe like you have type A. Is that true?
Councilman, I'm sorry, we're going to need an epidemiologist or the Florida Department of Health to answer that one.
Oh, okay. One other, well, I guess probably the second question would be the same deal then. Would take a medical expert. Okay, thank you.
Hi, I have a couple questions. I think some of them have been answered, but I have my own way of looking at the data that comes in. We have so much data that comes here. I think it's really hard to analyze it and put it into context. And one of the things that I have monitored all along, and I've asked the council to look at, is utilization rates. And I was concerned about the change in the Lee Health utilization rate, which I observed with the numbers that were brought here, because they had been running in the 80s and now they're 90s. But I think that was because we were using a different denominator. So I think that it would be good for people to know that if you're tracking a trend like utilization rate, that there was a change in how we're presenting that data. It still suggests that 90% utilization is an issue that should be addressed, and that I, for one, are relying on Lee Health to use their administrative skills to be certain that we don't get in a situation where we're in any sort of crisis that we had observed in other states. So I have confidence that you're doing it. You've already described how you're going to do it, and it was comforting to me to hear that NCH has the capacity of increasing their beds from 700 to 1,000. Do you have the same problem about staffing them when you do that? How would you do that?
Yes, Commissioner, we would have the same problem with staffing. I was citing that we have the ability, physical ability, to expand our bed capacity from our license of 715 up to over 1,000, but we don't have the staff today to take care of 1,000 patients in our institution. And as Michael indicated, the real challenge for the hospitals here in Southwest Florida today is that this is a time of the year. For example, our institution has 715 beds. We usually at this time of the year are running a census of about 300. Today we're running 470, 480. Middle of last week we were up to 500 patients in the hospital. You know, we rely on seasonal staff during the wintertime to staff when our capacity increases, obviously. And this time of year, you know, the staffing, we've let our seasonal people go home. We thought the pandemic had died down. They went home, and so now the real challenge for, I think, both of ours, I don't want to speak for Lee Health, but I would imagine their challenge is the same as ours, is really finding the nurses and the physical therapists and the nursing aides and that type of staff to handle a significant increase in patient volume.
Is part of that volume kind of a catch-up because we had stopped elective surgeries?
You know, early in June, we saw an uptick in the elective surgeries that had been held back during the March, April timeframe. But I think we're kind of over that now. We're looking at our surgery volume, and it's pretty normal right now, our elective surgery volume. The key to stopping elective surgeries is for patients that are going to need a bed post-surgery, is you free up that bed. And that's why we would look to, if we were going to stop elective surgeries, so that we had the bed capacity available for other patients. But our volume in surgery really is kind of normal right now.
And could you help me? One of the things that I monitor is I look at the line data for deaths, and I did look at the Lee County individual case information for the last, let's say, month or so, 6 weeks or something. And there's not a lot of extra information on that, but they do give age on it. And what struck me over looking at the last 6 weeks or so is that I had expected to see a lot of deaths where people were my age, 70, 80, and 90 or whatever. And there were very few people that had that age demographic. Most of them were what I would call middle age, or even less than middle age, 3 to 50. I would like you to sort of verify that that observation was the correct one, but also to reconcile with what you just said before, is that the death rate is increasing. So it tells me that the people that are being infected are the less vulnerable people. They should have less extreme disease, and one of you said that that was what you're experiencing in your hospital. So how could the death rate be increasing if we're having younger people and we're seeing less extreme disease and they're only staying in the hospital for a couple of days versus 7 or 8 days?
Councilwoman, thank you for asking that question. Part of it has been that the age demographic has been trending down for a bit of time in terms of the death rate. And so, yes, it's been spreading amongst a younger population at this point in time. And yes, that population, excuse me, is less susceptible, but that does not mean they are immune to having an adverse effect. So unfortunately, there are younger people who will still succumb. And as a result, your overall median age will be driven down.
Is that because those people that are in the younger group have what's called comorbidities, that they have other health problems?
That could certainly be part of it.
Is that what you think is the reason why these people are unfortunately passing on?
Councilwoman, that could certainly be part of it. If you have comorbidities, you are certainly more susceptible to succumbing to COVID.
And I have one question about bending the curve, because I think that virtually all of us in this country have bent the curve everywhere where we've had some problems, including here. When I looked at that early recommendation and the diagrams that were shown, I don't think we were clearly told that what we were doing by bending the curve was eliminating people who were going to succumb to this disease, because the area under that curve was the same whether you had a big spike all at once or whether you spread it out over a longer period of time. Was that a proper assessment there, or do we really think that what we're doing is preventing deaths?
I think the long-term goal is to find a way that we can, as a society, work through this together. So if we right now do not have herd immunity, and if we do not have a vaccine, our goal right now is to protect as many lives as possible until we can reach those outcomes. And so at this point in time, we know that physical distancing and masking work, and they're some of the few tools we have to prevent people from getting COVID.
So we're saying we're lowering the risk, but we're lowering the risk of specific people getting the disease. But is the number really changing? Or are we just spreading it out over a longer period of time? That's the question.
Understood. At this point, we're spreading it out over a longer period of time, and that's the answer.
Mm-hmm. Okay. Thank you. That's all I have for now.
Yeah, that was actually, that last question was one that I was going to ask. I appreciate that. As far as the daily stat sheets go, Michael, I want to thank you for that, because we go through those every single night. We have, I think Amy might have ran point on that, they add in influenza and everything. So we, every single day, track everything going on, but you guys put that together for us, and I appreciate that. So thank you very much to Lee Health for doing that for us. What is the current recovery rate? What is the current mortality rate?
So our mortality rate has changed in the last few days. It's a little over 4% at this point for Lee Health specifically. Okay. I'm not speaking to Lee County or Southwest Florida. It's a bit over 4%. And our recovery rate would be I'll work on that. So we have 1,397 patients that we've recovered and discharged, but the total is a moving total. So if I use that as the numerator and the running total is the denominator, I'm not going to have an exact answer for you. So if you give me just a bit, I'll get you an exact answer.
Okay. Do you have a ballpark?
The ballpark would be 1,397 divided by 29,557.
Okay. Who's got a calculator?
No, we all did.
Somebody on staff want to calculate that?
Well,
No, but
pardon me, Councilman, I'm sorry. So I just gave you the positivity rate and recovered and discharged rate, but we didn't treat everyone who was positive. I apologize for that.
But the mortality rate you're calculating is not a traditional mortality rate, which is the death per population. Isn't that correct? You're saying of all the people that are confirmed positive in your, and even hospitalized, you're not even saying the people that could be not in the hospital, those people die. I assume that most people die in the hospital, but I guess some of them could die at home.
Pardon me, Councilwoman. I was answering two separate questions
Okay.
there. The latter was the recovery rate, and I apologize if I created confusion there. In terms of mortality rate, you're right. For the county as a whole, there are a number of people who have not come through our hospitals that are part of the statewide DOH statistic that they're tracking.
So the mortality rate, just about 4%. The recovery rate,
I'll get back to you with a better answer, Councilman. I apologize.
okay. Do you feel that you are, I'm sorry? Okay. Do you feel that you guys are employed at a high enough rate currently, and how long until you think you will be there?
So we've been very proactive in terms of trying to bring staff back. I had mentioned at the onset that we're working to bring folks back from sabbatical, to recruit staff, working with the governor's office and FEMA to try and bring more down. The goal is, at this point, to try and have every one of our licensed beds get to be an operational bed eventually, and we're hoping sometime in the next 2 to 3 months we'll be able to reach that goal. So we're talking about roughly 240 beds that we can add.
Great. And then last, when we are talking about the mortality rate, with these numbers, do you have a percentage of people who are coming in on non-COVID issues or are not dying potentially of COVID, but then are then being added to these numbers as an ongoing basis of part of this mortality rate? So, for example, somebody comes in, they have an asthma attack, they also have COVID, now are they a COVID death, and do they stay on that continually?
Councilman, that's something we would have to verify with both the Department of Health and the mortician for the county, just to be able to make sure that accurately after the fact it's staying the same. But I can tell you that when someone's COVID positive and we treat them, that's how we're marking it. So if someone comes into the hospital being treated for COVID and passes away, that's our COVID statistic, our COVID death statistic.
Okay. Thank you, Michael.
I'm going to actually piggyback off of that. So, Mike, and I remember the numbers, or I would ask you, Phil. But you said 358 COVID patients, and 15 were in rehab. So, of the 358 that came into the hospital, it was solely due to COVID-19.
Solely due to COVID-19. Councilwoman, if they presented for, say, the emergency department because they had a heart attack or something else, and they tested positive for COVID in treatment, we would, after treating them for the heart attack, we're still treating them for COVID.
Correct.
So, but not everyone that presents came to the hospital because
So
they
now,
thought
if
they had
that
COVID.
person died, would it be the heart attack or COVID?
It depends on the point in treatment. If someone is in the hospital for a number of days after having a heart attack, I need to speak to a cardiologist to let you know when they're past the point of, being
It's really
considered.
hard to understand you. So I heard coroner.
I apologize, Councilwoman. I'll try to project.
What?
I think her question was, Michael, are those numbers, are all of the COVID numbers for the mortality rates, are you including other things into those numbers?
Yeah, well,
So-
was there an underlying cause of death other than COVID-19?
Potentially for presented patients, that could be the case, but to the best of my knowledge at Lee Health, that's not how we're scoring the data.
Because the CDC said that's how they were categorizing all deaths that occurred. If the person was positive, it was considered a COVID-19 death.
Okay.
Well, do you also test for the flu? Do you test for the flu?
Based on symptoms.
Yeah. So if they come in, they're not feeling well, you do flu and other types of colds?
It depends on how they presented to us. So if someone came to the emergency department and were displaying symptoms that were common with influenza or common with COVID, and some of them overlap, they might run a test based on asking the patient questions.
How many are just negative and they're just panicked and over concerned and just need to know that they're not?
When they get tested in our internal labs, that's a patient that's at the hospital, so they're being admitted.
Already there?
Yes, ma'am.
Thank you.
Yes, a question. Could you describe the other serious negative adverse effects that a patient that survives COVID could end up with as a result of his COVID illness? And specifically, I've read about kidney problems, heart problems, lung problems. Now there's a concern about conditions reflected in the brain. So could you just describe some of the other negative adverse effects that can be serious from COVID? Because that's not the only negative outcome.
Councilman, to your point, I've read some of the same studies, but I am not subject matter expert and couldn't comment to the long-term effects.
I have a question for Phil. You had mentioned that right now you're running about 100 beds over normal for this time of year. What was the number of COVID patients in the hospital currently?
At NCH right now, we have 133 positive COVID patients in the hospitals.
So roughly the number of COVID patients.
It's about a third of our patient population right now.
Okay. But that's about the number that you're over from normal this time of year.
Yeah,
you said you're about 100.
Normally we would have a census, a total census of about 350 patients. So we're 100 to 150 patients higher today than we normally would be.
Okay. And also, every day we get a lot of information. We do get some more information from Lee Health than we see from you guys. We typically see how many patients are in there each day and what the percentages of ICU beds are taken and ventilators, things like that. Is there any way that you could get us that information each day also?
Sure, and I apologize for not sharing that with you. Yeah, we certainly can provide that information. And for the benefit of the council members, NCH and Lee Health have a daily conversation about both of our situations. We're in communication on a daily basis. In the Collier County area, we have a daily phone call in the afternoon with the health department, with PRMC Hospital, with Healthcare Network of Southwest Florida, with the neighborhood clinic. I mean, we have a pretty exhaustive list. David Lawrence Center, all the healthcare providers in Collier County. We're on a daily conversation with them about the different situations, and we share that information. So we'd be more than happy to get a contact here and have that information provided to you. I did provide you some statistics there, and I didn't really mean to overwhelm you, but those are examples of, number one, there's a chart there that talks about the different counties in Florida and the bed capacity, and I think the ICU capacity, and that's available information that we'll share with your staff to access that on a regular basis. There's also 3 different documents in there, the state of Florida, Collier County, and Lee County, that breaks down the demographics of the COVID-19 positive patients. So you can look at, in Collier or Lee County, what the age distribution, ethnic distribution, racial distribution. You can look at all that information is available on the state website. And we'll provide your staff with that link so that you know.
And if things did get worse, do you guys have a way of, either through the state or the federal government, of getting extra staffing or beds set up like they did in New York City?
Beds would be, I think, available. I think, again, our biggest challenge that we have sleepless nights over is where we get the staff.
But in an emergency, you would
in
be able,
emergency,
you do have contacts to where you can get the
yes,
people.
And there's always staff, travelers, seasonal people at a price to bring staff in, certainly.
How much
Thank you.
money did NCH lose?
I'm sorry?
How much money did NCH lose since March?
Right now, we're projecting, our fiscal year is October through September. Right now, we're projecting to lose about $40 million this year. We lost, in the month of March, I think we lost something like 24 million, and April was about 9 or 10 million.
And Lee?
Thank you for the question, Councilwoman. So we're still working on, we received CARES Act dollars like many other facilities, and we projected losses. The projected losses were over $100 million from suspending elective surgeries, from a number of unfortunately good folks that lost their insurance when they didn't have an opportunity to work. So we saw a lot of non-paying patients in that resort. So as we've ramped up elective surgeries again, we recently, in the last few days, had to restrict it by 25% to ensure that we had enough PPE to cover the growing capacity. And so I'm sorry, I can't give you an exact number on loss.
Thank you.
Anybody else up here have a question? Chris and then Fred.
Okay. It was reported in the Naples Daily News today or yesterday, I don't know which, that zip code 34135, which is basically the zip code from US 41 East, has been designated as a state hotspot for COVID cases. The definition the Florida Health Department uses is 300 cases. As I understand it, the number of cases in that zip code is well in excess now of 600 cases. Is there anything special that Lee County, Lee Health or NCH focuses on when a area becomes a hotspot? Is there any special advice you can give with respect to how to contain that? I know that the bulk of that, I'm especially worried about the population in the minorities, because the minorities tend to have poor health care coverage. So I'm just wondering, is any sort of an outreach program to some neighborhoods in Bonita Springs in the offing because we are a hotspot?
And I'd like my esteemed colleague to address this one as well, but I think both Lee Health and NCH have outreach into many of the communities that require additional assistance, not just during this COVID pandemic, but beyond. We have community benefits that we work hard on. To your point, the Department of Health does a zip code tracking for all the zip codes in the state of Florida, and they have a heat map essentially, so I did note the heat map that you're addressing. We strongly advise that people wear face masks, wash their hands, and physically distance. Right now, as I said, in terms of mitigation, that's really the most we can do. And in terms of treatment, having the availability to have staff and beds to treat them is what we're focused on.
Thank you.
I think Fred's got something. Hey, Fred?
Yeah, I have two questions. Whichever one of you feels that you can contribute to it. Number one is there's a new drug that's not FDA approved, but it's allowed to be used. I'm told that it's really doing a lot of good for the COVID patients. Is that correct?
I'll take this one. Fred, frankly, neither Mike nor I are capable of providing that kind of expertise, clinical expertise. I mean, there are a number of drugs, and remdesivir has been a useful drug to both healthcare systems, particularly for patients that really have a lot of complications and comorbidities. It's proven to be a pretty good drug, and right now we seem to have a fairly good supply. We just got another big shipment in over the weekend, so I think both institutions. But in terms of drugs being used on this disease or this virus, we're probably not the clinical guys that you want to ask that question to.
Right. And the next question, and if, keyword if, if we happen to adopt a face mask mandate that you have to do it, only going into buildings, you know, like retail, restaurants, offices, and all that, would a 6-week period, if we did that, sufficiently give enough time to show if that really will reduce the number of new cases per day?
Once again, I don't know that I'm nor Mike's qualified to make that prediction. I would tell you, as Mike indicated, we've had two employees at NCH throughout. We have 4,500 employees that have contracted COVID-19 and have been quarantined because of an exposure in the hospital. And that's only because we have followed evidence-based guidelines of wearing masks, good hand hygiene and social distancing, and where appropriate, wearing the appropriate PPE equipment. If you do that, our evidence shows that you can keep a population safe.
Mr. Mayor, just briefly, to your point, Councilman, if being the key word, I would ensure that you review the statistics as you go. So is 6 weeks a fair amount of time to reassess? I imagine it is, based on what we know of the gestational period of COVID and what we know about lagging data. But I would, if being the key word, I would make sure to review it continuously in hopes that you are making an impact.
Thank you.
Anybody else? Mr. Mayor, if you're with us, did you have any questions?
He's on the line. Let me just.
Mayor? Mayor Simmons?
I guess we'll open it up to the public comment on the phone if
So
they're
you do-
ready to go, or?
Yes, you do have two folks on the phone waiting for public comment.
Okay, let's start with them.
Go ahead.
Hi, this is Elaine Bogdanoff.
Thank you.
Do you hear me?
Yes.
Yes, we can.
Okay, so I'm assuming this is a discussion about the mask mandate. And I am going to say right off the bat, I am for a mask mandate, as I've been listening to some of your questions about number of beds available and number of COVID patients and hospital staff available. I'm envisioning a severed carotid artery and people gathered around discussing how much gauze is needed to mop up the blood, when the discussion, I think, should be about stopping this bleeding and suturing the carotid, which to me equals mandating masks. Florida has had over 12,000 new COVID cases this past Sunday. If Florida were a country, it would be fourth in most new cases. The increased cases are not the result of increased testing. If they were, hospitalizations would not be increasing. Florida has had 7,000 COVID hospitalizations Friday and 8,000 yesterday. 40 hospitals across Florida have no remaining ICU beds. Florida hospitals, some of them are using refrigerated trucks as auxiliary morgues. Our local counties have in the past and will see an influx of visitors, say from Miami-Dade, or from counties that have tightened restrictions or rolled back their openings. This virus will migrate to us. Florida positivity rate is currently about 15% across the board. The CDC suggests a rate of 5% or lower for a 14-day period prior to reopening from lockdown. If our goal is to preserve our local economy while also preserving life and flattening the curve. We need a solution. How do we do this? Well, Japan has had less than 1,000 total COVID deaths. Japan is 12 times more densely populated than the U.S. They have more elderly per capita than any other nation. They never did a complete lockdown. How did they do it? Virtually everyone wears a mask. Florida adopted the Indoor Clean Air Act, which prohibits smoking in indoor environments. This smoking ban eliminates the public act of expelling toxins from one's respiratory system that are potentially harmful to others. Coronavirus is airborne. It is spread through coughing, talking, breathing, and a mask mandate would eliminate the public act of expelling toxins from one's respiratory system, just like smoking, that are potentially lethal to others. So this is not a limitation of freedom issue, because we have a smoking ban. Studies show that COVID-19 transmission could be reduced by up to 33% if 95% of the population wear masks. And remember this, that 30 to 45% of those who test positive are asymptomatic spreaders. So if you're standing in a room right now with 10 people in it, over 4 of them could be spreading COVID-19, and neither you
wanna wrap it up?
nor they will be aware of it.
10 seconds to finish up.
That's it. Thank you.
Thank you. Next phone call.
Thank you.
Linda?
This is Linda Schwartz. Yes, this is Linda Schwartz. First, thank you to the mayor and council for your service. This is a difficult time for our city and our country, and you are being asked to make decisions that should have been made at a higher level of government. But here we are, and we must act. We need to pass a mask ordinance because Bonita is the hot spot in Florida, and Florida is the epicenter of COVID in the world. The epidemiologists at the Philadelphia's Policy Lab estimate that if Lee County does not quickly turn things around, we will see thousands of COVID cases by August instead of the hundreds we are seeing right now. We already had 1,285 cases on Saturday. So why not pass a mask ordinance? Perhaps we should look at some of the objections and misinformation laid out in a YouTube video that District 2 Councilor Jesse Purdon sent to city staff to share with the mayor and council members. This YouTube video is by Dr. Kelly Victory, a trauma physician who, according to the Denver Post, is well known for promoting coronavirus conspiracy theories and unproven cures. I don't know the date of this video, and new information is coming out almost daily, so perhaps she has updated her thinking. But let's look at some of the things she says in the video about masks. First, she says that masks are only intended for the ill and those caring for them. This is not true. There's information coming out stronger all the time that about half of those who are infected have no symptoms. So everyone should wear a mask. Another thing she said was the World Health Organization and the CDC have said there is no justification for normal, healthy people to be wearing masks. Again, not true. Both of these organizations are now saying that it is the single most effective thing we can do to prevent the spread of COVID. Some other things included that prolonged mask wearing increases the risk of disease to the wearer, and habitual wearing of masks decreases the body's natural immune response. Again, not true. Immune systems work through memory after coming in contact with bacteria or virus, and masks don't prevent that from happening. It is unfortunate that the wearing of masks has become a political or civil liberty issue, when it is clearly now one of the most effective things that we can do. So we don't want to wait until the hospitals are full please do the right thing and pass this ordinance. Thank you.
Thank you.
Deputy Mayor, that concludes the public comment via phone.
Okay, and we heard back from the mayor. He didn't have any
He
questions.
should be on. Mayor, can you hear us?
Yes. Yes, can you hear me?
Yes, we can, sir. Thank you.
Thank you.
Did you have any questions, Peter?
I really don't. This has been pretty thorough and pretty exhaustive with the information. I want to thank Lee Health and everybody. I know there's a lot of emotion around this issue. I know there's a lot of statistics around this. What I continue to hear in the numbers is discrepancy in the numbers. I think people can look at these numbers a lot of different ways, and I just want to thank everybody for their concern, for their time and their effort on this issue. So thank you.
Thank you, Peter. At this time, I'll open it up
Yeah,
to...
and I guess, and I'm sorry, I would just add one more thing. We've been doing daily mayor calls, which have now dropped back 2 or 3 days a week now for several months. And one thing possibly, which, and if it was answered, I apologize, but somebody may go in for a different illness or have different illnesses. They may test positive for COVID-19. Then they get better. But the numbers never drop off once they've recovered. Is that still the case? In other words, the numbers are still there. In other words, they don't say, okay, so-and-so tested positive, but now they tested negative. However, the positive number stays on the charts and does not drop off. Is that still the case?
Correct. The NCH representative is nodding his head that it's a cumulative number, and that when people do recover, they do not drop off that roll. But he's going to...
That's unfortunate, but I appreciate that clarification because that adds unneeded drama to how the news reports it and how people perceive it. But I appreciate that clarification. Thank you.
You're welcome. Actually, Phil's at the podium now to answer.
Mayor Simmons, this is Phil Dutcher. And yeah, once a patient that's admitted to the hospital tests positive for COVID-19, that becomes a statistic and it never goes away.
I appreciate that, Phil, and I'm not shooting any messenger or pointing a finger at anybody. It's just unfortunate that those numbers are reported like that, but it is what it is. So I appreciate that clarification. Thank you very much.
Did you have any other questions, Peter?
I'm good for now. Many of them were answered, and I thank the council and Lee Health and NCH and everybody. Thank you.
All right, thank you. We're going to go back to public comment. Anybody here in the room would like to come up? There is a 3-minute time limit, and make sure that you please fill out the comment cards and turn them in, and state your name for the record also.
My name is Barbara Ogle, and I'm sure you can hear me with my mask on. I have typed and retyped my notes for tonight's meeting, just going over things over and over and over again. You've heard from experts, you've heard from residents. I myself conducted an informal survey on the Nextdoor app. The total was 246 responses for yes, 44 for no. The council is supposed to represent the district they live in. I can't believe that with the 34135 being considered a hotspot, that the council members that represent that zip code would not vote in favor of the mandate. We are looking for leadership from our council to help keep our businesses open, employees working, and the economy moving along. I know that some people believe that wearing a mask is a violation of their civil liberties, but sometimes you have to make sacrifices for the greater good. This is the time to make hard decisions to protect the residents of Bonita Springs. I wear a mask to protect you. I would like the same for others. I'd also like to mention that we have to turn our cell phones off when we come into these meetings. And I look up here and I see city council people typing on their phones, not paying attention to us. We're supposed to pay attention to you, looking at your laptops. We're not allowed to do that. So I would appreciate the fact that the council please at least look at us, acknowledge us when we speak, and listen to our words. Thank you.
Thank you.
My name is Joe Calabrese, and I'm the president of the Bonita Bay Community Association. I'm here tonight to reinforce a letter our organization recently sent to all council members, endorsing the passage of an ordinance mandating the wearing of a face mask in public. Our community's COVID-19 infection rates are out of control. In the past month alone, infections have more than tripled in Bonita Springs. Our local hospitals, as you heard, are reaching their capacity and are going to have difficulty expanding that capacity due to lack of staff. Healthcare and other essential workers are overburdened at this time and really at risk needlessly. Wearing face coverings along with social distancing and frequent hand washing is our best hope to constrain the spread of COVID-19. You've heard already that the Institute of Health Metrics forecasts that 33,000 deaths in our country could be avoided by October 1st if just 95% of people wore masks in public. Bonita Bay consists of 6,000 Bonita Springs taxpayers. Almost all of us are over the age of 60. As such, we're among the most vulnerable to the ravages of this virus. We want to feel safe in our own community. We want to feel safe as we go about our daily activities. We don't want to be forced back into a lockdown situation. We expect the leaders that we elect, we expect our leaders to act decisively in the face of a real threat to our well-being and health. All we ask is that you mandate a temporary, minor inconvenience of wearing a face mask in public. We know it will save lives, it will keep our businesses open and save jobs. Quite frankly, it's the right thing for you to do.
Thank you.
Hi, my name is Holly. I live in Bonita Springs, 34135 for 17 years. Taxpayer, voter, homeowner. I've lived in Florida for over 40 years. I see so many people in this room not wearing a mask that are not taking this serious. I live in a house with 3 immunocompromised people. My husband has cancer. And it's really sad that people think this is an inconvenience or a discomfort. I would like to ask one question. Is a ventilator and an ICU bed and death convenient for any of you or for your family members? Because I have family members who have died from this. When a 30-year-old boy can lay on a bed and say, "I made a mistake," those were his last words. He thought it was a hoax. Think about that when y'all go to bed tonight. And please take us seriously. Do what we elected you to do and protect us. Our governor is not doing it, and our president is not doing it. Thank you.
Thank you.
Hi, Peggy Kestenbaum. I'm from, live in Bonita Bay, Bonita Springs, and I guess I'm going to be the odd one out here because I resent the fact that you would mandate anything to anybody. I think people have personal responsibility. I don't think we're taking it as a hoax. I certainly don't. As you can see, I'm wearing the mask now out of respect for other people. Also because I believe if I go into a store and they ask me to wear a mask, I will comply. But I do not think I should be mandated by anybody. That is not your job to mandate to me my responsibility to myself. Not the government's job is to keep my constitutional rights. It is my job to keep my body healthy, not your job to keep my body healthy. I also believe that we all have that personal responsibility. I'm sorry for the people who have comorbidities. I also would like to know how many people in a hospital, and I can't even breathe with this thing now, because I think for healthy people, this is extremely unhealthy to do. For children, this is extremely unhealthy to do, and traumatic to have children under 8 years and younger, they're saying now, that have 8 years and older, 8 years and younger, a 9-year-old, a 10-year-old, an 11-year-old, to walk around and see people with masks on. I think that's outrageous. I think it's outrageous. I'd like to know, really, how many people are counted?
It's just public comment. We can't ask questions now.
Oh, okay. Well, a question that I had, that I'd ask myself, because I'd like to know stats, because stats are very easily manipulated for many reasons, monetary reasons, political reasons, personal reasons. All of you up here have a personal bias, whether you want a mask or not a mask. Myself would like to know how many people the stats show go into a hospital with the virus, that die with it or from it. There's a big difference. And the CDC has put out stats that anybody that goes into a hospital that has the virus, no matter if it's secondary or not, is considered that. The other day there was in the paper, 30% inflation rate. There's just an article just the other day, that reports that Florida virus numbers era are wild, that negative results are being unreported, only positive results, and sometimes doubled. So you know what? It depends on how you read statistics. It's what you do with statistics and how you manipulate them. You're sitting here, one person with a mask. The whole day you've been going like this, you've been going like that, you've been going like this. That mask does you absolutely no good. Do you think people in the street, in a store, are gonna once you do this, the mask does nothing for you. You're talking about the CDC and the WHO? All right, well, I'll show you, I can read you a quote from the CDC people are quoting. This is, the chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic,
Okay,
meaning
that was
it
your-
is symbolic.
That was your 3 minutes.
I'm done?
Yep, thank you.
I am done.
Sorry.
And I'm probably the only one that feels that way.
Thank you. No applause, please. Welcome.
Members of the council, my name is Representative Byron Donalds. I'm a member of the Florida House of Representatives. I represent House District 80, which is Eastern Collier County, all of Hendry County. I reside in Naples, not in the city of Bonita Springs. I've actually spoken at several of meetings similar to yours in the cities of Cape Coral, the city of Fort Myers, and most recently earlier today at the Collier County Commission, which incidentally just voted down a similar provision about 20 minutes ago in the chambers of Collier County. You guys got a lot of pressure. I understand what you're having to go through. Your citizens, frankly, are on both sides of this issue. But the one thing is clear that there are many citizens who are concerned about the impacts of the coronavirus on their health. Citizens obviously don't want to see the virus spread. I don't want to see it spread. And I think we all have to do our duty to make sure that we not only slow the spread, but beat this virus. But I come to this meeting to actually inform you about the limits of your powers. The one thing in this mask debate that's not really stated is what is the authority of city councils and county commissions as delegated by the state of Florida. Under the state's constitution, Article 1, Section 23, there is a right, a very broad right to privacy for the people of Florida. That is not to be infringed by, frankly, the state of Florida itself, members of the legislature like myself, or members of cities and county commissions. Furthermore, Article 1, Section 1 of our Constitution states that any powers not expressly delegated still belong to the people themselves. This is not the United States Constitution, this is Florida's Constitution. And this is important because right now we're under a state of emergency issued by Governor DeSantis. But even under emergency powers as outlined in Florida statutes and the breadth of those powers, nowhere in that article, in that section of Florida statutes, does it give local governments the authority to mandate what citizens will or can wear. The powers simply do not exist. I've talked with some of my colleagues who are going to be returning to Tallahassee in the fall. Many of them are actually quite concerned about what's been happening around the state because we've never contemplated such an issue. So I think what's important to note is your powers with respect to business licensing, what businesses in your communities can or cannot do, is actually quite broad because you have licensing power as a city council. But you don't have powers to actually mandate what citizens wear. That is a power that's never been given to local government. It's not a power the legislature's even considered giving to anybody. I would argue that even the governor, under his very broad powers, which exceeds yours, frankly, doesn't have the power to tell citizens in our state what they can and cannot wear. And I've not spoken to the governor about this in particular, but I would speculate that is why he has not issued a mask mandate. Again, this is very touchy, and I understand people who are concerned about public health. I'm concerned about public health. But there is a limit to governmental power that must be respected in the times of peril. That is the reason why we have the form of government that we have. That is the reason why individual rights have been respected and protected in our country since its founding. And even in times like this, where there is a very real concern from this virus, we have to maintain that restraint of governmental power. Simply put, it's not been delegated to you by the state of Florida. I would recommend that you educate your citizens. You even, in your budgets, if you have it, find a way to get your citizens the PPE and other things that they need to protect themselves if they so choose. But it is clear by my reading of statute, you do not have the authority to issue this order. Thank you, members.
Thank you, sir. I would ask everybody to please refrain from applause on both sides, please. Thank you.
Good evening, ladies and gentlemen. My name is Dan Thompson. I am a resident of 31435, and it broke my heart to hear that we are now a hot spot. Sir, I commend you on wearing a mask. I commend your communication staff for wearing a mask, and the ladies over here on the table wearing their mask. I support a mandate for a mask. I understand that it may not be in your power, but I also believe in the chain of command. And the chain of command starts at a local level. It starts with people like us getting together and communicating our concerns, and you communicating up the chain of command. 2 years ago, thanks to the wonderful medical staff at NCH, I survived 17 days in a medically induced coma because of the influenza. I wear my mask not to protect myself, but I wear my mask to protect you. That's the only reason why I wear my mask. I'm currently on a heart transplant list with Cleveland Clinic in Weston, Florida. And yes, I'm concerned of my health and the money that I have spent to keep my health alive. But I wear my mask for you. I served to protect you in the military for 12 years. I serve today as a Deputy Chief of Staff, National Deputy Chief of Staff with the Veterans of Foreign Wars. I wear my mask to protect you. I would hope that you would wear your mask, whether mandated or not, to help protect me. Thank you.
Thank you. Thank you for your service.
Hi, I'm Lisa Smith Horowitz. I reside in 34135. I'm a health professional for 33 years, New York State, Florida State, into natural healing for a long time studied. And I am so opposed to the mask wearing. Number one, because there's been so much propaganda and so much censorship about what really is going on here. There are, for all the people who are over 60 and getting those flu vaccines, there is the COVID virus the last 3 years in the flu vaccine. There are many viruses put in the vaccines. In chemotherapy, you need to know that. You need to be informed. This is an atrocity, what's going on here, and they have you believing you need to wear masks. It's not protecting you, and you're not protecting me. You're not protecting me, you're not protecting my children, you're not protecting my patients. You're actually doing harm to yourself. You're not getting proper oxygen, you're breathing carbon dioxide. You are gonna have a heart transplant? I don't even, seriously, can everyone wake up? Really, this is an atrocity what's going on here. You're all fooled. It's mind-boggling. Like I'm having anxiety when I see people with masks. I want to say, don't you know what you're doing to yourself? You're not protecting me. You're not protecting your family. You're actually playing along with their game. You're eating what they're feeding you, the bad pharmaceutical. It's in the air, the chemtrails that they put up. A month when we could finally go out to Dog Beach, to the beaches when they opened up. First, chemtrails. All the viruses are in the chemtrails. We are all positive with COVID, if that's true, and it's true. I ask that you look into that, look deeper into all of this. The flu vaccine, and of course our area was targeted. They're targeting the poor. Immokalee, the slave trade that's going on in Immokalee, that's been going on forever. Bonita residents, please, everyone wake up and stop watching the mainstream news and start looking into what's really going on. The truth, dig deeper. It's not all right there in front of you. There's the depth of this heinous criminal activity that's going on. We have a worldwide Holocaust going on. And that's what I got to say.
Thank you.
I'm not for masks. Take the mask off. Thank you.
Good evening. My name's Todd Truex. Can you hear me okay?
Yes, sir.
I'm going to keep my mask on. This is my license. I'm a nursing home administrator licensed by the state of Florida. I've been responsible for the care and services for over 20,000 residents in Southwest Florida. I was the president of the Florida Healthcare Association, District 16. I live here in Bonita, and I care about the data. These two gentlemen represented the data from NCH and Lee Health System. You need to listen to them. They have the data. They know about the importance of the need for the mask, the difficulties in staffing. I have been there myself. Just having beds available, empty beds, doesn't mean you have the staff to take care of those people in those empty beds. People are seasonal, and I used to take nurses from Canada and Rhode Island, Massachusetts during the season to help my increase in staffing. If we don't mandate these masks, no shirt, no shoes, no service, no mask. It's not that difficult. It costs you nothing. It costs you no money. It doesn't cost anything from the taxpayers. In fact, it saves money by cutting back on our expenses for uncovered medical services for these people. Please vote for the masks. I beg you. My name is Todd Truax. Again, I live in Bonita Springs here in Hawthorne. I've been here for 12 years.
Thank you.
Oh, good evening, Mayor, or Deputy Mayor, council members. Can you all hear me all right?
Yes.
For the record, Dwight Essman, Paradise Road. Requiring face masks in indoor public spaces is a restriction of my freedom. Bet you didn't think I was going to say that. Believe it or not, I used to smoke cigarettes. And I was really upset when I couldn't smoke in bars and restaurants anymore. Any of you who were or still are smokers will know that cigarette with a drink after dinner was important. Plus, then I couldn't even smoke in my office. Had to go outside in the heat and the rain, the cold. How unfair is that? But the government passed a law that said I couldn't smoke indoors. Some people said secondhand smoke wasn't dangerous. Some people said it was. The science said it was. The science now says that you can spread COVID-19 without knowing that you're ill. So I wear a mask partly to protect me, but mainly to protect all these other people in case I'm contagious. You'd think everyone would do that out of courtesy, but they don't, because it's become about politics, not about science. Other people have told you many, many, many reasons why the masks are important. I don't need to repeat them. This is a case where people's lives are more important than some petty personal freedom. Pass this regulation because it's the right thing to do. Do it to save lives and our economy. And because the vast majority of the people in Bonita want you to pass it. If you read all those comments that came in, there were like 127 of them. I think 5 of them said no.
30 seconds, right?
And I just want to point out, Mike, Jesse, you guys have talked about your district being the working class. I bet you your people want to have their customers wear a mask when they come in their place of business. Thank you.
Thank you.
Good evening, everybody. I'm Sandy Gibbons, and I'm a resident also of 34135. And I don't pretend to know very much about Florida law, and at the risk of disagreeing with our representative here, I know that the state of Florida will not tell me what to wear, but they will tell me I have to wear something. And if I were to take my clothes off right now, Captain Lee would be up here in a heartbeat arresting me for public nudity. Please, do the right thing. Let's try it. Let's try it for a period of time and see what happens. Thank you.
Thank you.
Thanks, guys, for listening. Thanks for taking time to let us talk and everything. I appreciate people who wear masks, and I wear them from time to time, especially if I'm around more vulnerable people. But as always said, you sort of got to listen to the details. Words matter. It's always said, we're slowing the spread, slow the spread. Nobody ever says stop the spread. Nobody ever says you're not going to get it. They say slow the spread, which is good, to allow the hospitals to manage it. That's what we were told at the beginning, 2 weeks, a month, 2 months, slow the spread, so the hospitals can manage it. They weren't overwhelmed, which is good. What did they do? I don't know about these guys, but nationwide pretty much laid off a lot of people. Excess staff because they weren't doing the other procedures. All right, so if they got to adjust now as it's spreading, they need to hire more people. You need to get more beds. That's how it works. All right, I'm sure there's funding, grants, and things like that from the government. Otherwise, as a business, you should do that. I appreciate people who say they're protecting me. I don't need that. I'm a teacher. My wife's a teacher. We have kids, grandkids. Kids almost don't get it, don't spread it, apparently, according to certain studies, which I don't have in front of me. So definitely wear it if you're vulnerable. Definitely wear it if you want. You should not mandate it. Strong recommendations, fine. Anything short of a mandate, fine. Very strong recommendations, right? Probably based on the CDC. CDC, the federal government is not mandating it. It's a strong recommendation. Do that. Spread it around, mail it to people, email everybody. If you really care, make some signs. We strongly recommend. If there's mandates, then there's enforcement. How's that going to work? A couple quick things. These are rhetorical questions. I didn't know we couldn't ask questions here. I wonder, we're a hotspot, of the cases, how many of those are confirmed positive tests? How many of those have multiple tests to confirm them? How many of those are estimated based on how many people they hung out with or interacted with? We tested one positive, we can extrapolate out maybe 5 or 10 people in the area have it. So that's cases in hotspot is not a real strong definition. Of those cases, how many were asymptomatic? How many had symptoms? How many of those symptoms actually had to go to the hospital? How many of those had comorbidities?
30 seconds.
All right, so there's all kinds of unanswered questions. You guys got to really listen to statistics, really listen to that stuff. There's a couple other things, questions that I have in my own head that I can't ask. That's about it. Make a strong recommendation. Don't pass a mandate, especially time frame. You never know. This could peak out. I've done research on COVID, SARS-like viruses. It could peak. Nobody knows for sure. They could peak and come back. Peak and come back could be 1 year to 10 years. Is that what we're going to do? 10 years, everybody wear masks? But I appreciate your guys' concern who want to wear masks and protect us.
Thank you. Mr. Abel, can you state your name for the record, please?
Chad Abel.
Thank you. Any other public comment? All right. Seeing none, go back to council. Any more conversation?
Well, I'd like to have some more conversation about the fact that 34135 is at the level that it is. And it was something that I had begun to talk with Arlene about weeks ago, irrespective of where the numbers are here, because I was concerned about the demographic statistics that were coming out nationally, and I didn't think that we were able to get a good handle of our own city. So irrespective of what happens here, I would like to have the council have a discussion of how we could address that particular area. If it is a demographic issue, then I think we should do, think I recommended to Arlene that the outreach committee take responsibility for that because they have connections. But I think that's something that we can handle irrespective of this. So we could just, we can't decide it here, but I'd like to follow up on that discussion that I had with Arlene to see what we could do about it. Because I don't think we haven't had the information. I think we don't have complete information about the testing. It's very frustrating to hear these testing numbers, the positivity rates and all that stuff, and not really know how it affects us, we in Bonita Springs. So I think we can ask our professionals a little bit more to help us with that, but that's something I would like to follow up on. And another thing that I think I would like to ask our professionals is because I am as concerned as anybody else about the numbers that we see both locally in the Lee County and Collier County and the state. But I don't feel that we have had the opportunity to put them in context. And the only way we're going to put them in context is to relate them to other health challenges that we have. The numbers are just alarming that we hear every single day, but we don't get a report of every other disease that happens and how many people die from them. So until we get them in that context, I don't think we can really appreciate it. And the third thing I want to say is that I am very concerned about the expressions of what I can only characterize as fear from the statements that have been presented to us. I can appreciate them. I'm a super senior. I'm immune compromised with my husband. I wear a mask to protect myself and others. So I'm in the same situation you are, but I really work hard every day not to be fearful because I feel I'm in control of my own health. And whatever happens here today, I want to get that. That's one of the messages that I want to get out to our people here in Bonita, that you are in control. If you really have a concern, you have it in your power to put on your mask and to narrow your interaction with other people. That's what super seniors are doing. We don't see many people. We don't get out very much. And I do that because I want to protect myself and others. So it's not, we shouldn't be in a period of despair no matter what the situation is, whether people wear masks or don't, because we still have a lot of control over our own health. So I'd like some feedback from the other councils, see how they feel about it, and I have some other points to be made, but I'll pass it to other people now.
Mike?
Chris?
I'd like to speak. This is my green sheet, and I thought I would make comments about why I am supporting the mandate. First, I want to thank the 130-some citizens that wrote in our emails expressing their views. I think it's interesting to note that none of those emails were form letters. They were written from each individual based on their own words. So that wasn't a campaign. It was simply people speaking from the heart. I want to thank everyone here, and especially the hundreds, because I know there are hundreds watching this on television in Bonita Bay and in the rest of my district and throughout Bonita Springs. Bonita Springs is at a crossroads where the interests of those who insist on wearing masks infringes on their personal rights and those that believe we must do something to turn the surge in COVID-19 cases and protect their lives or protect the lives of people they serve. My parents were descendants of people from Scotland. I often heard this prayer in my home, which is ascribed to the Scottish clergyman Peter Miller, who said, "May we think of freedom not as the right to do as we please, but as the opportunity to do what is right." If we are to do what is right, then let us start to find what it is that we can agree upon. We should be able to agree on the following data points. The chart I passed out to all the council members was prepared by Johns Hopkins School of Public Health. And it represents the 7-day moving average of new cases in the United States, state by state. Notice that Florida is at the top of the wave, and it does not look like the wave has been crested. Starting with the date of Phase 2, June 4th, the Florida Department of Health has reported more cases than Italy has reported since the beginning of the pandemic. The number is 230,000 cases since June 4th. Italy has a total of 230,000 cases. Remember all the TV coverage of Italy? Since July 1st, the date of the last council meeting, the date that we refused to ask the Lee County Commissioners to restrict the hours of Lee County beaches to be the same as Collier County, the Florida Health Department has reported 126,000 new cases. Since July 1st, COVID-19 cases have more than doubled in Lee County. Since July 1st, the 7-day moving average of death from COVID-19 has grown from 38 to 81 in the state. Deaths take an estimated 25 days to report into the Florida Health Department, working their way through the systems. So the ones reported today are mostly deaths from around June 20th. COVID-19 cases in the 34134 and 34135 zip codes have grown to over 700 cases, 600 and more being reported in 34135. Death is not the only negative outcome. I'm so tired of people talking about death. Death is only one outcome. Other effects include kidney, heart, lung, and brain disorders. Next, we should be able to agree that the CDC, the World Health Organization, and most respected epidemiologists believe that wearing masks and social distancing are important to stopping the spread of COVID-19. Perhaps you don't agree with that, but we can agree that this is their position. We've just heard from Lee Health and NCH as to their recommendations. The single most effective thing we can do is social distance and wear a mask. That COVID-19, we can agree that COVID-19 is a concern for healthcare workers, restaurant workers, and employees in businesses that interact with the public. Healthcare workers not only deal with cases of COVID-19, but also take as much care as possible that they are not exposed to the virus and bring it into their healthcare workplace. Teachers are concerned with exposing the children in their classes. Restaurant workers are concerned with exposing patrons and their own families. You may think their concerns are foolish, but we can agree that this is what they think. Census data indicates that 40% of Bonita Springs residents are over the age of 65. CMS research finds that 80% of all Medicare patients, 65 and beyond, have at least 2 comorbid conditions. Thus, they are at high risk. In our community, the math works out to 19,000 Medicare patients that are at high risk. Again, this is just data, so it is what it is, but it has led Bonita Bay to reverting back to the Phase 1 status under the original Phase 1 governor order. Now, I know that some at this meeting will say that the COVID-19 problem is media hype, that wearing a mask infringes on personal liberty, that COVID-19 is just the flu by another name, that all these concerns are foolish, that wearing masks is unconstitutional, that you can find doctors that don't agree with wearing masks, that we need herd immunity, etc. Yet, think about it. It doesn't really matter what you or I believe. You can believe whatever you want to believe about COVID-19, as can I. Trying to change views about the medical reality of the pandemic is like trying to change views on social media. Did you ever win a debate on Facebook or Twitter? Not likely. No, the only thing that really matters is what the majority of people in Bonita Springs believe. The public is really in control, despite what we do here tonight. And if our residents continue to lose confidence in their ability to stay safe while shopping, or going to the doctor, dentist, or pharmacy, if they feel they are at risk going out to dinner with all the precautions taken by restaurants, if they are afraid to send their kids to school, If they must stay home because they are at high risk, then the local economy shuts down. Because after all, that's the elephant in the room. Telling them just to stay home if they're fearful does not help the local business owner. Again, note that 40% of the population of Bonita Springs is over 65. That represents 24,000 people that have the bulk of the discretionary income that's spent in the local economy. Add to this the concerns of Canadians coming down to Southwest Florida next season. We have 450 in Bonita Bay, so it's reasonable to estimate that there's maybe 2,000 total or more in Bonita Springs in season. They left early this year because of concerns over their insurance coverage. The Canadian government gave them a date to get home. If they did not comply, the Canadian health insurance would not cover COVID-19. Now they're wondering with the surge if they will be back next season or not. And if you notice today, Canada extended the border closing until August 21st. The same is true of our own American residents who went back north. Spending the winter up north may not be ideal, but they are wondering if it will be safe to come back next season as well. Local businesses suffered during the last shutdown. Some didn't make it. Others hung on by their fingernails. These local businesses are not as healthy as they were before the pandemic. If the public acts to cause another shutdown, whether the governor orders it or not, it will be disastrous. People lived through a shutdown once. They now know how they can do it. Experience is a great teacher. If they don't feel safe, they'll do it again. This is a reason I think we can agree on mandating masks for employees of businesses and in public places as well for their customers and patrons. Let's not make this a political problem. Let's not get lost in the data. Let's think about it in terms of saving our local economy and protecting our residents. We need to take action not only to turn the surge, but to avoid having our economy at Bonita Springs shut down again. Again, let us think about freedom, not in terms of what we want, but rather doing the right thing. The right thing is an emergency order to wear masks in businesses that interact with the public and in other public places. Our job is to both protect the public and save our economy. Our own city staff has shown us the way with the mask requirements they put in place at City Hall. Let's do our part. Thank you.
Anybody else? Laura?
I haven't changed my perspective from March 13th. I saw that video that woman mentioned, and ironically, she said exactly what I said, so I just thought it was brilliant. She said it much more eloquently, but it took her a lot longer. So I believe we protect the vulnerable. We go ourselves and protect ourselves. We go to our physicians, our healthcare service, I don't know, clinic, and ask what's good for me. Here's my situation, and then act accordingly. In the governor's executive order, Governor of Florida has issued Executive Order 2020-83, directing Florida Surgeon General and State Health Officer to issue a public health advisory to all persons over 65 years of age and to persons with certain underlying conditions that place them at high risk of serious illness from COVID-19, to urge them to stay home and take measures to limit their exposure to COVID-19. COVID-19's greatest weapons, fear, panic, and the media's relentless negativity and fatalism, the hyperbole, the flip-flops, the who, the Faucis, the Beachies, all of them going flip-flop, flip-flopping. Take care of yourself, but we have to stop killing our economy. All right, kids are already back in school in England, in Italy, in Venice, in Austria, and Germany. We have, our kids are going to sit out of school. It's just amazing that we're not opening our bars. Don't go. Really, don't go. You could catch a really bad cold. But this is going to be with us. It has been with us. And Fauci in 2015, when we had COVID, 2015, he again said, don't wear a mask, don't wear a mask, different president. But this year, February 29th, 2020, Fauci adamantly said, no masks, they do nothing, they're actually harmful. And then somehow, within 13 days, the country shut down. So it must have been some weekend for him. And that's all I got to say.
Before I make my comments, I was going to ask, capitalizing on what the mayor said, could we at least just Bonita Springs get from Lee and from NCH what the total number of cases you've treated and then what you're currently got in the hospital from here on out, because that would at least give us better information and the public, which would lessen the fear factor. Here's what I think about this. And first of all, I respect the opinion of everybody in the room, everybody on city council. I think with the great number of cases that we have been being the #1 nation, and that's not the badge of honor to be #1 in the state, the Florida, being #1 for the USA in cases. I think it would be at least worth trying to see what would happen if we adopted a resolution, not an ordinance. An ordinance is a law. Under the emergency powers that we're operating under, I believe we can do it with a resolution. Is that right?
What's proposed now, what is proposed now is a resolution, which is an emergency order.
Right.
So it's a resolution under Florida law is considered to
I
be
think you have to
temporary
speak
in
into your
nature.
mic.
Right. Okay. So he answered the question. Now, my proposal is this, that we would carefully implement, because you don't want to shut the economy down. I don't want anything to do with that. But I believe we could at least see if we could implement an order for 6 weeks. Why 6 weeks? That's about the length of the shutdown. Let's see what happens. We're either going to get a big drop in the cases. That's what a lot of you think. If that's the case, we could, our option, extend it a week or 2 or even 6 more weeks. If we don't get a big drop, then some of the people that are saying that the masks don't do what they're supposed to do they would have more justification to say we shouldn't do this. I don't think 6 weeks is that big of a loss of our personal freedom. I think you have to use your common sense. Like, I'm not wearing a mask here. I had it on when I came in, when everybody was around, but I'm at least 25 feet minimum from any of you guys out there, so I'm not a risk to you and you're not a risk to me. But I do think it's worth trying it. We have to be reasonable. Enforcement may be an issue, but we'll have to see what happens. That'll come out of this 6 weeks process. Even if we don't get 100%, if we get up to 90%, that still should have an effect if the people that say the masks do good are right. And both the healthcare people, that's what they're doing. So they must have some knowledge that we don't. Admittedly, the masks they have are better than what you got. But it's still the theory that even the lesser grade mask will still do good. We're only going to find out. If it doesn't work, it doesn't work. If it does, then we can evaluate, did we get enough of a drop that we want to stop it? That would be my proposal. I'm not for a permanent deal. I'm for testing it to see what happens. Thank you.
Jesse? Or
Oh,
Amy?
sorry. I would just like to ask Derek to opine, I'm sorry, in regard to whether we have the authority to do this.
You want to get back into that after I talk?
Yes, I do believe we have the authority to do this. I have reviewed What's before you today, at the direction of Councilman Corey, is a variation of the Hillsborough County order. It seems to be in the midline of where they are currently in the states. I've reviewed all the litigation that's currently pending. Almost all of the cases that are pending against local governments have been dismissed for lack of the ability to meet the burden of a temporary injunction, which was the primary basis under which they were operating. Many of the defenses that have been raised were already raised today by the public and others. For instance, nudity, which I think, based on Representative Donald's comments, is probably the closest corollary to the right of privacy that the Florida Constitution provides. That right of privacy under the Florida Constitution is a limited right. It is limited by the other rights and obligations contained in the Constitution by its very terms. In those rights includes municipal local home rule, and there have been local ordinances passed on issues such as nudity, which have survived constitutional scrutiny. So the question, what I would say is that I think the ordinance is within our authority. We have not been preempted by any level of state law on this issue. I think that it would survive constitutional attack. Now, whether that means it's the best policy issue or it is a practical, enforceable order is a separate issue. But do I think it would survive attack? I think it would.
Okay. Well, that answered my first question. I do think the council, well, I don't know how to go about this because I'm not totally in favor of the what do we call it, a resolution that's before us, because I have concerns about enforcement, and I think that we need to discuss that as a council. I also didn't agree with all the comments that Councilman Khoury said, but there's no point in debating that. I have a similar concern about the fear that exists out there. I do not think it'll be solved by wearing masks. I think we have to do a lot more education in that. So that is a second area in regard to figuring out what's happening at 34135. So I think we have a lot of work to do here. I'm going to vote in favor of this, even though a lot of my philosophical considerations is not in agreement with my own philosophical considerations. But I made a statement and I want to just make a few points, which I hope we could incorporate it into some kind of activity from the council. First of all, the guidelines that we have come down from the White House, the governor, and the county. And first of all, I feel that those entities have done a pretty good job. I'm not one who thinks that there've been a lot of mistakes that have been made all along. But the guidelines include several things: sanitation, social distancing, use of masks in enclosed spaces where social distancing is not possible, and isolation of the vulnerable, where they are to avoid what they call the 3 C's: closed spaces, crowded spaces, and close contact with individuals. And for those over 65 with health risks and those or with health risks, we've been asked to limit our personal interactions outside the home. None of these guidelines were meant to be a pick and choose. So we can't just say social distance and then everything's going to be all right. We can't just say wear our mask and everything's going to be all right. There was a whole task force that came up with these guidelines, and I think they're good ones. And until we have more experience with this virus, and I do not believe this virus is going to go away this year or next year, whether or not we have a vaccine because of all the complications of administering vaccines. So we need to develop a procedure that is practically efficient. But in the same way, I am very cognizant of the fact that our businesses are hurting, but more importantly, our people who do not have jobs are struggling. So whatever we do here has to encourage our society to function as normally as possible. And that, I think, is why I'm going to support this mask ordinance. I don't agree with a lot of things that were said by people. I think a lot of it was based on fear, and it's not a good idea to make decisions on that basis. But I think we can work on the fear in a different way. I do want to mention that council has received numerous email communications, and typically I respond to every email I get. I have not responded to any of them. They were just too many, and frankly, they basically said the same thing. But I want you to know that I took them seriously, I thought about it, and I've been considering my decision here for a long time now. Again, I summarize those communications. The vast majority advocated for a mandatory mask resolution, though others appeared to make it voluntary. One thing that struck me is that so many expressed this fear that Councilman Curry had mentioned. Many alluded to high personal risk because of age or comorbidities. I can understand that fear because of the constant bombardment of data that is unfortunately out of context. I have been spending a good bit of time tracking data. I have an economics background, so statistics kind of makes me interested in it. I try to focus on things that are reliable. Not a lot of data and information comes out through the media, especially through all these emails that we get, through Twitter, to Facebook, to people talking, to videos. It's not reliable, and it's hard to discern what is correct and what is not correct. But I'm trying to get a perspective of what's happening. And my own personal conclusions is that there are certainly risks, but that I have within my own power to minimize those risks and to expose myself through my own behavior to less risks. So when Bonita Springs authorized an opening of the euphemistically called non-essential businesses, we emphasized compliance with all the CDC guidelines. As I ventured out personally, I selectively patronized those entities which followed the guidelines, and I wore my own mask. This is the very best protection that each of us can take. That is also the very best enforcement mechanism that can discipline our businesses and their patrons. Voting with our feet and pocketbooks. And as I say, I'm going to vote in favor of this, but I still believe that that's the best way to handle this, because we're introducing an enforcement policy that I think is going to hurt us in many ways. One of which is that, first of all, we operate under the philosophy of government-light governance. That means we have very minimal staff to accomplish all the activities that are required of our government. And then we're going to ask either the sheriff or our neighborhood services or both to enforce this and perhaps impose a fine. I think that the environment in which we're operating, where we're nationally, we're rethinking our relationship between citizens and enforcement agencies. It's a very bad time to put an additional responsibility on those two entities. So I don't really like how we can enforce it, but I don't see how any other way of doing it. So I have some problems with that. The second thing is that there's been reports in the media about person-to-person interactions with people who are in favor of masks and people who are not in favor of masks. We are in a situation because there's so much stress from us being bombarded, I think, with a lot of the data, that we're not behaving very well. I'd hope this doesn't exacerbate those situations, and I appeal to anybody, no matter what happens here, to try to refrain from personally interacting with people because they might have a different point of view. Most of the points of views are substantiated in some way. Maybe not the same way that you feel, but they're not totally crazy people that are out there having a different point of view. And I want to take the time to thank all our businesses who have worked to open their establishments in this very challenging environment, and the patrons who have ventured out to support them. Lee County has over 60,000 people out of work, and that cost is something that is just not really appreciated when we discuss these kinds of things. So whatever we can do to try to help our people who are going to be looking for jobs for what I believe is going to be a long time, we have to do it. And again, I'm not 100% sure this is going to do it. because I don't believe wearing a mask, even if it's mandatory, is going to get away from this fear. We have to do a lot better than that. I think we can appeal to our professionals here to give us, both in the media and in the healthcare industry, to help us to see and put all these things in perspective. We have made the fear here. We have contributed to it. And I think we need to stop it and go in the other directions. It's one thing to be realistic and one thing to be histrionic about it. So help us all to doing that. That's my little speech for tonight, and I am going to vote in favor of it, but I would like the council, if we decide to go in a positive direction, because we haven't taken a vote, is to explore the consequences of the enforcement mechanism, and to explore the consequences of what we could do to handle specific problems in 34135, and what we can do to, no matter what happens here, we have to have a big re-education process and outreach to all our members. So that's the way I feel.
Thank you, Amy. Jesse, and then Fred.
Great, thank you. I just want to start by saying that I've been up for the last 2 nights thinking about this. I've had a very hard time sleeping about this because, and it's not that like this isn't political is BS. Okay, I'm a realist that this isn't political. I'll tell you what, I got about 120 emails, and 90 of those were copied and pasted, and one of those had an actual piece of the email from a councilman on this board who actually wrote an entire speech for them that they then copied and pasted to us 40 times. So, not being political, I don't buy that, that's fine. Moving past that, I think that I had 2 conversations on the way over here that really helped me solidify my position on this. Before I even get into that, the reason that I was kept up, it wasn't the nasty emails calling me names. It wasn't saying, Trump's dropped the ball, DeSantis has dropped the ball, you guys are just as dumb as them if you do the same. I ignored those ones, okay? The ones that kept me up are the seniors who are currently scared, and they're at home. And I feel that, the vote that I may or may not make is going to make them think that I have not heard, have not read, or am not concerned. And nothing could be further from the truth. But here's my position. My 2 phone calls on the way here. The first one, you may have been following what's going on in the state right now with municipalities who are doing these mandates. The state rep from the Orlando-Volusia area has filed 9. In my conversation today, which was it was a cordial conversation, I was informed that we will get a lawsuit tomorrow morning, and we will be number 10 if we pass this ordinance today. So, coming out of 2 lawsuits, which a lot of you know who are big city people, we just got out of 2 decent lawsuits. Now we're being literally told by somebody who has sued 9 municipalities, I'm suing you in the morning if you do this. To me, whether Derek's opinion is correct or not, and quite frankly, I love Derek and I think he's awesome, but I feel that it is not within the scope of my authority as a city council person, because under the Florida Constitution, citizens have a right to privacy in their personal lives that is even stronger than that right of privacy under the federal Constitution. Article 1, Section 23, which Representative Donalds brought up, says that every natural person has a right to be left alone and free from government intrusion, including into their private life. Never anywhere in that Constitution is it given back to us. It's to the state legislature. So I believe I'm out of my lane saying that I can do an ordinance which constitutionally I do not have the right to do. That aside, many people thought the Constitution argument was going to be my main argument. It's not. The lawsuit is one of them, but the second call was with our sheriff. And I talked to Flagler, and if I sent staff, the Flagler County Sheriff did an excellent piece on this whole issue, but I read it 20 times. I talked to our sheriff about it, and he expressed very serious concerns about a mandate being both overly burdensome, but also very difficult to, as far as the enforceability standards go, because of the numerous factors associated with masks. Our cities and communities are in a heightened state of racial tension like we've never seen. The financial and economic uncertainty is making people act emotionally more reactive than they would under normal circumstances. So mark my words, if we pass this ordinance, we're putting law enforcement in an unsafe situation that will likely lead us to bad outcomes. The number one situation that they go into that is a problem for them is a domestic. And a domestic, you have people who are highly agitated. Now, think about this. You're going to have neighbors calling on neighbors. They have 6 people over at that house. I didn't see any masks. You know what? They could have asthma. They could have some other issue. It's not tattooed on their forehead. And even if the police officer goes up to him and says, hey, why don't you have your mask on? If he says he has asthma, he doesn't have an asthma card to prove it, so the officer says, okay, great, have a nice day. So my issue from an enforceability standpoint is, A, how do you enforce it? You can't. So if you can't enforce it, why would you pass it? Number one. Number two, we're going to put law enforcement in a situation that our sheriff and many other sheriffs around the state have said they have actual police work to do. They cannot be the mask monitors. And it's going to put them in a very bad spot. I always think about our law enforcement, always. They're in a bad spot right now. I don't want to add to that position by making them arbitrarily walk up to people and enforce a mask ordinance that really and truly, again, is out of the scope of what I think we are allowed to authorize. To recap this, I just want to be perfectly clear. It's unenforceable. I feel it's outside the scope of my authority as an elected member of this body because I'm not a state legislator. And additionally, I feel that putting our officers unnecessarily in harm's way is the wrong direction, and knowing with 100%, this isn't a question of maybe we'll get sued, 100% we're getting sued. If we pass this, we're in a fine, whether we win, lose, or draw, you have to defend yourself. That's going to cost you money. So now we're automatically going to court for something that we can't enforce at all and is going to endanger law enforcement. For those reasons, as tough as it is, I believe that we need to definitely have a very strong recommendation for businesses, for activities, but I can't get behind an actual mandate knowing we're going to get sued, knowing what law enforcement is now going to have to play enforcer. I can't do it. So, that's where I'm at.
Fred?
First of all, I was at a meeting of the Southwest Florida League of Cities chapter, and Mick Denham, who most of you know, the vice mayor of Sanibel, he told a very interesting story about the very thing that we're wrestling with. Sanibel, maybe a month, 5 weeks ago, passed a resolution strongly urging that the mask be worn when you go into retail stores, offices, public areas. And what happened was we only got about 40–50% compliance. So what happened somewhere between a week or 10 days ago, the council kicked it up a notch and went to a mandatory situation. What happened was that most of the merchants and the office owners and all that actually thanked city council because they said it made it easier for them to get compliance in their places of business. And you could very well have this here. No one, first of all, if this would pass, I'm not going to vote for it unless it's limited to a 6-week sunset. Then we see how it's been, and then we can decide to tear it up and throw it away, or hey, this is really working, and let's go a little longer and see if we can get the numbers down. I think that your enforcement will be a problem, but I think that if we do it, you're going to go from wherever we're at now, which I don't think is very good when you go into the stores and things like that. You may get up to 90%. If you get 90%, that's way better than where we are. You're going to know if this is really going to work or it isn't. and we're not going to do it to where you have to do it out in the public, where you're outside. We're going to use common sense, and social distancing is still a key to it. But that's what I think. I do not believe if we do this that any officer is going to be in harm's way, because the only way it would be if some resident goes wacko, and if they go wacko, then that's called resisting an officer, and then they would be in trouble. I don't want to get anybody in trouble. I don't want to put anybody in jail for not wearing a mask. I would like to see if this would stem the tide. I think it will. I don't have scientific proof, but I know this: if the hospitals are doing it, and you've heard their rates, two that they had, that's pretty good. So but we're not going to do that good. But trying it for 6 weeks, I don't think is that big a deal. That's all I have to say.
Okay. My feelings on this, businesses have a right to require masks or not require masks. Everybody has a right to either shop at that business or not shop at that business based on, their feelings of safety levels. We all have a personal responsibility to, take care of our own safety, our family's safety. If I was going on a plane or my parents were going on a plane, I would recommend that they wear an N95 mask, because that's going to protect them from everybody around them. I just don't see, infringing on everybody's rights and mandating a mask ordinance and mandating that businesses require everybody to wear a mask. So I think it's up to the businesses, and then it's up to the consumers whether they shop at those businesses or not. If many businesses are impacted by that, they may change their mind and require masks. Being the only person that responded no to wearing masks when it was polled by the newspaper, I will say I have worn masks 3 times since I was asked, and up till that date I hadn't worn them at all. The one was the store required it, so I needed to go in there, so I put it on. Another time it wasn't required, but they politely asked, so I wore it. And the other time, mask is back on, without having to have tickets at St. Leo's, but they do require masks, so I wore a mask to attend church. So, like I said, if a business requires it, I have the choice to whether I want to wear the mask and go in. If I have another option to go somewhere else, I might do that, or I might wear a mask and go in. So, I personally don't feel that we should be mandating masks. So, if the mayor doesn't have any comments, I'll entertain a motion, but let's just double check with him. Let's see if the mayor has any comments first.
Thank you, everybody, and I just want to say I've been listening, and as one that's traveling right now with a family of 4, we wore masks up on the airplane, in the airport, in the airplane, the entire ride up, driving from a lot of college campuses to college campuses, paying tolls, paying money at a toll booth, dropping a dollar bill into a fish den, watching people interact, watching people respect each other, watching people be careful and cognizant of everybody's personal responsibility and their personal space. That is what it's about. If you can't respect other people's space, don't go out in public. If you have to mandate something to get what you're looking for that's unenforceable, it's not the right way to go. It's about personal choice, it's about personal freedom, it's about personal liberties, it's about avoiding a lawsuit, it's about respecting where you go, who you're with, and your choices are obviously your choices, and they have responsibilities. But to mandate something, to try to mandate something that our sheriffs cannot enforce, to try to mandate something that's going to bring on a lawsuit, I apologize. I have read the emails. Yes, I've been on the road. I've responded to a lot of them. Like Amy said, they kind of were overwhelming in the sense that I'm sorry I could not respond to all of the emails. I very well may. I may sit in our hotel room tonight in Princeton, New Jersey, I might add, and reply to all of them. But I want you to know I've heard your thoughts, I've read your emails, and I just, for something that is unenforceable and going to bring on another lawsuit and quite frankly unconstitutional, I cannot support it. So thank you.
Thank you, Peter. Chris, it's your green sheet, so.
Yeah, I'll make a final comment. You know, all major metropolitan areas in Florida, with the exception of Jacksonville, have mandated masks. Hillsborough County covers Tampa. Pinellas County covers Clearwater, St. Petersburg. Miami-Dade has done it. Broward County has done it. Orlando has done it. So, Jesse, if in order to protect our citizens, you know, I got to get in line with those municipalities who are much better funded in order to defend a lawsuit. I'm more than happy to do that. If I'm number 10, I'll stand behind number 1 through 9 and say, take your best shot. Second, once again, we've heard the cry that it's personal freedom, it's independence, that we're responsible, but mostly what we heard about is my decision about what I want to do to protect myself or my family. It's not there's very little talk from the opposition about what is it I want to do to protect the other people in Bonita Springs. So it depends on how you want to cut the cake. It's, you know, I prefer to look at the community as a whole. I think we have good people in Bonita Springs. I think if we pass this emergency order, that we will have automatically 95% compliance. And it's drafted in such a way as to give the business owner a little more in their toolbox to insist on compliance. If you notice the way the order is drafted, it says basically if the business posts a sign, if the business announces that, you know, it's the policy of the business that people wear masks in their business where social distancing isn't possible. If the business's own employees that interact with the public comply, there's no onus on the business. They met their burden. The burden is on the customers and patrons of the businesses, the restaurants, the public entities like museums and so forth. And it's where it should be. And to now get, you know, so what we've done in this resolution is exactly what Hillsborough's done. They had another bite at the apple and they made these modifications. That's why I chose it. You know, it's designed to help businesses. It's designed to give people confidence to go back in to restaurants and drugstores and go see their doctors and to get out into retail shopping and so forth. So, you know, if the council wants to vote this down, I'm glad that this is being watched by hundreds of people, and we'll go on record as to how we stand, I think, on this important issue. And that's all I want to say.
Okay. Did you want to make a motion?
I'll make a motion to approve the order. With Fred's amendment, that there be a 6-week sunset provision, that we would take a look at what the numbers are, and perhaps by that time, Lee Health and NCH can give us some of the data that Amy's requested, others have requested, but yeah, with a 6 month, we'll take a look, see if we made a dent. I don't know, you know, I'm looking at my graph prepared by Johns Hopkins University. If we don't do this, how do we turn this curve in our own community? So that's all I want to say. But I do all this.
Did you second it?
I think Fred said second, I'm not sure.
Okay, there's a motion and a second. Any other discussion? Roll call.
Councilman, I just want to be clear, a yes is in favor of Councilman Corey with the amendment, and a no is no against the motion with the amendment, correct?
A yes is in favor of the motion for the masks for 6 weeks, and a no would be against the requirement for masks.
Just wanted to make sure I heard it correctly. Thank you.
Thank you.
Councilman Purdon?
No.
Councilwoman Carr?
No?
Mayor Simmons?
No.
Councilman Corey?
Yes?
Councilman Gibson?
No.
Councilman Forbes?
He said yes.
It was a yes.
Councilwoman Carumba?
Aye.
4-3.
All right, the motion fails.
Fails.
Deputy Mayor?
Yes.
Since we're here, could we talk about this issue in a different way, which is raising the kinds of things that I have raised? Can we start an effort to focus on 34134, getting input from professionals, getting some additional information, working on, I think to address the fear that's in our community, we have to work on the messaging that comes from the media and from us.
Wash your hands.
You know, we can have as strong a message without a resolution with the items that were presented here, and to get that, you know, develop a message to all our businesses. I've said from the beginning, don't we know who our businesses are? Why can't we at least get an email out to every business that lives in, that exists in Bonita Springs, and reinforce this, that this is what they were expected to do when we allowed them to open in phase 2. I mean, those kinds of things, I don't want to just let this go, because there is I think what Councilman Curry brought up is an important issue. We may not agree with his solution, but let's keep talking about this and try to do something positive and active.
Yeah, absolutely.
And I would say, in addition to that, being the council member who is now the liaison to outreach, and being a very, very active member of the 34135 zip code, I would love to talk to you about that from an outreach perspective.
These are things I kicked around with Arlene, and I mean, we could get together and notice the meeting, you know, and do it on Zoom. But I think there are things that may not make any sense, but that I've been thinking about that I want to work on. I know we're all incredibly busy with so many things over the next couple of weeks, but I think that we can be more proactive in addressing this. I'm very concerned about the fear that's been expressed here. I'm very concerned about sort of the despair that they, you know, if this council doesn't do this, we're all going to die. I mean, I don't believe that. And a lot of the things that we're saying here, both pro and con, I could have a whole conversation about, because I don't agree with everything, but I agree with some of the things. So there's a lot that can be done here, and I just don't want to end it. So that's what I recommend, that we do that.
Councilwoman Carumba had mentioned an ability to set up a meeting with the chair, the new chair of the outreach committee too, to express some of her thoughts. So we could do that individually as well.
I would love to do that. Thank you. No, that's great. I'd love to do that.
All right, is there a motion to adjourn?
Motion.
Thank you, Mr. Mayor, for joining us.
Bye, Peter.
Thank you, everybody. Good night. Thank you.